Welcome to the Presidential Symposium Series. I don't know how many of you joined us last symposium, which was in October, but this series is entitled Connected to the Future. And we spent this morning talking to each other in a breakfast meeting to be able to engage. And Bob already shared with you that you are sitting in a TED Theater in the mind, which is meant to bring us together to really have, hopefully, provocatory thoughts with respect to where we are. And I appreciate the question that was asked just a moment ago with respect to how do we, in the context of this university and the state-of-the-art theater, relate to our communities, right? That was the question that was posed. How are we accountable to our communities to make a difference? So that is what we are going to engage in this morning in those discussions. And the reason that I want you to be active in that discussion is because it's going to take all of us to engage. So it's not just the university who's here, and hopefully we can say we are about knowledge, right? We're about thinking, knowledge, new knowledge. But the thing that universities perhaps have failed to do in the past is the application of that knowledge to do good consistently. And so the discussion that we have today in welcoming you, the faculty, the staff, the employees, all the trainees across all disciplines, okay, and our community. And I thank so many community leaders who are here, and I'll continue to recognize them formally, and industry partners, is because we're not going to solve this, the kinds of things that we talked about, not only the beauty of this region and our communities, but the serious problems that we have unless we are fully engaged together. So I want to especially recognize and thank the presidential student ambassadors. If they are present, could you please stand? Right. And I do that deliberately because guess what? She's the future, all right? She is the future, and she's going to be hopefully supported and guided by our wisdom. And I do want to also formally recognize, I think, Deb Cody, who is Senator DeFrancisco's representative, Joe Romano, Assemblyman Magnarelli's representative. There are so many, Linda, Eric Bitterbaum, the president of SUNY Cortland. I don't think I've seen Deb Stanley, although she was scheduled to be president of SUNY Oswego. The student representative, Ambassador Heidi Button-Mueller. Very good, thank you. We had a breakfast where we had many representatives from the community, Walt Dixie from the Jubilee Home, Sharon Owens from Syracuse Community Connection, and many others. And I can't name you all because my task is certainly to talk to you and to introduce the Lieutenant Governor, who has taken some time to be here with us and returning to be with us. A year ago, I outlined, and I'll go through this quickly, 6 symposia, all right? And yes, it was intentional that we started with genes and precision medicine to anchor us on the science that we provide to this community, right? And we had Mary Claire King, as was mentioned, and I chose Mary Claire at that point for 2 reasons. One is the excellence of her science, but that's not sufficient. I chose her because she was also a human rights activist and applied her science to do good. And the other symposia that I'll mention is Transformative Education, Health Professionals for the 21st Century, which will be next year, Equity and Medicine, Life Course and Lifespan, and Environmental Sustainability, so look forward to that. But today's symposium is entitled Society and Health and consists of a series of conversations regarding the social determinants of health that must be tackled if we are to achieve the greatest gains in health improvement. And we had this conversation this morning that we as physicians, other health professionals, are just a small part of the health dynamic, right? The larger context of health is we know it. It's the environment, it's our communities, it's the policies that we have that help to determine whether or not where our zip code is determines our future or not, okay? I could go on, and I had some other thoughts in terms of strategic planning, but I'm going to skip that to be able to introduce our Lieutenant Governor. We're extremely fortunate today to have featured presenters, and I want to recognize our keynotes. Steve Wolf, Professor and Director of the Center of Society and Health at the Virginia Commonwealth University, who we will officially introduce later. And he will be talking about getting serious about population health, the importance of cross-sector collaboration. But it is now my distinct pleasure to formally introduce our New York State Lieutenant Governor, Kathleen Hochul. And I know I'm going to digress a little bit and say that she visited us, 2-3 weeks ago, a few weeks ago. And she came to Syracuse, and she starts from Buffalo and goes to Albany and all around the state, but now has made Syracuse a destination. And I had the pleasure of introducing her to our facilities and our communities, and obviously not a new introduction, but we discussed many things, including coming back here. She is here to help kick off our 2-day dialogue. She is the president of the New York State Senate and chairs the New York State Regional Economic Development Council that I'm fortunate to co-chair our regional REDC with Rob Simpson, who I did not see, but I was hoping, Rob is there, very good. And Kathy Hochul actually chairs all 10 REDCs and co-chairs the New York State Heroin and Opioid Abuse Task Force and Community College Councils. She was appointed by the governor in that capacity, and as such, she convened 8 outreach sessions across New York State to hear from experts and community members in search of answers to the current crisis, which we know is not a new crisis. It's just a light has been shown on that crisis, but we have had the crisis of drug use and drug abuse and deaths in many communities. I certainly lived through that in the Central Harlem community when we were afflicted by crack cocaine and the impact that it had on so many communities around the country. Lieutenant Hochul spearheaded Governor Cuomo's also Enough is Enough campaign to combat sexual assault on college campuses beginning in 2015, hosting and attending more than 25 events. As the highest ranking, it says female elected officials, and hopefully in the near future we won't have to say that because we'll just be spreading across, right? And that goes for many other things. She continues to be a champion of women and families. If we don't speak out for women and children, I don't know what we're about, okay? So thank you for that. And actually I always learn something new when I introduce someone. And here in March of 2016, Governor Cuomo named her to the New York State Women's Suffrage 100th Anniversary Commemoration and Commission. And I could go on. I can tell you also that she has her roots in Syracuse. She holds a bachelor's degree from Syracuse University and a law degree from Catholic University in Washington, D.C. And I could go on, but I actually am anxious to have her come to the podium. And I truly thank you for focusing on Syracuse and helping to craft what will need to be a comprehensive plan. Our title today is Society and Health. How do we embrace all of the agendas here to be able to improve health? So thank you. I'm really honored to have you here today.
Dr. Laraque-Arena, it's so great to be back. And I remember we were taking the tour of your beautiful facilities, and they are spectacular, by the way. And you just sort of planted this idea. He says, well, what are you doing at the end of March? And I was like, oh, man, I don't even know what I'm doing tomorrow. I travel every corner of the state, and it turned out it is in the heat of the budget negotiations. And so I had to get special dispensation to slip away from Albany, but I said, I'm not missing this event. And so I wanted to be here, and I got to race back to Albany as soon as we're finished after one more event here. But I love coming back here when I see what was my home for 4 straight years. It is great to be back, and I'm glad to see some students here. I was very involved in student government. I was vice president of student body. I was the student representative to the board of trustees. And whenever those trustees see me, they're like, oh, not her again. We had a good time. I learned a lot of leadership skills right down the road here, and about how important it is to speak up for what you believe in, even if you're still just a student. And one side note is I tried very hard to have the Carrier Dome named after Ernie Davis, who was the first Black Heisman Trophy winner. And we thought we had, righteousness on our sides. We had the student news here, the Daily Orange was with us, and the student body, and we had a lot of faculty and professors, and everybody was thinking this is a great idea. So as I was tasked to go visit the chairman of the board of Carrier Corporation, Mel Holmes, who also coincidentally was chairman of the board of the Syracuse trustees, and try and persuade him that he should be more community-oriented, and wouldn't it be great if they put up the naming money, but not call it Carrier, but call it Ernie Davis? So I kind of learned the art of negotiation at the age of 20 years old when I walked into his huge boardroom and walked out sort of empty-handed, but we did get an agreement that we would honor Ernie Davis with the field house, or the field named after him. So I was very proud when I go back there, at least to know, sometimes if you push for everything, you get a little bit of something. And so those are traits that I learned here that still serve me to this day. And one more digression, it was exactly 1 year ago today when I was on campus, and I don't want to make anybody feel bad, but we were sending off our men's and women's basketball teams to the Final Four. So we know how that ended. It was very proud to be here that day, and there's always next year. And this is from a Buffalo Bills girl from down the road. This is our saying, there's always next year. So I love coming here and happy to escape Albany. So this topic is so important to me. And I do have a bit of a history. You mentioned the crack cocaine crisis that plagued our communities, particularly the inner cities back in the 1980s. Well, at the time, I was a ripe old 26, 27-year-old, and I was counsel and staff assistant to Senator Danielle Patrick Moynihan, whose campaigns I had worked on back when I was just a kid, and he hired me a decade later. And we were tasked with finding a solution and bringing together the stakeholders, and it was a fascinating time in Congress. We had Ronald Reagan as president, Tip O'Neill running the House of Representatives, and the leadership of the House, or the Senate, was tipping back and forth by election. Every 2 years was flipping between Democrat and Republican. So you're not quite sure who you're dealing with. And as a staffer, literally on my first week on the job, the senator said, you go over with the Republicans and negotiate a plan. We're going to spend $1.4 billion dealing with the crack cocaine crisis. And I'm like, okay, sure, Senator. So it was actually a very different time in Congress. We actually sat down with the Republican staffers and got what Orrin Hatch needed and what Ted Kennedy needed and what Henry Waxman needed over in the House. And we pulled it all together, and we were very successful. And I won't go into all the details, but 1/4 of that $1.4 billion was allocated for the state of New York because we got very clever in the middle of the night writing the criteria for the assistance, and we pegged it to wait lines at places like methadone clinics and places where there were services. And because New York State was ahead of its game in providing those services, and we had a lot more need than able to provide services, we were able to dedicate literally 1/4 of that national money to the state of New York. So that's sort of my background. I sort of know how to find the money, and I'm really proud that we were able to do that. And I'll just fast forward to the time I was actually elected as a member of Congress a few years back, and what a different world. We never would have gotten that done because Democrats and Republicans, much less weren't in the same room working on plans. They weren't even talking to each other in the hallways. I mean, it's very toxic, and I'm very sad to report what I saw from a staffer to a member of Congress and how it changed so dramatically. But I'm really happy to be in state government because state government allows us a lot more flexibility to identify problems and to solve them. And that's where I took the opportunity to serve as the co-chair of the New York State Heroin and Opioid Task Force a year ago when the governor said, you know what, we've passed legislation, we have the I-STOP program to stop doctor shopping, which was becoming very rampant. We've done a lot, but we need to go out to hear from the people. And so I convened task force, one here right at Syracuse University campus, all over the state, talking to families, providers, doctors, the elected officials, bringing everyone together and saying, what are we missing here? What else could we possibly be doing to address this crisis? And I've never seen anything like this. I mean, I go back, I remember Senator Moynihan's history dealing with heroin in the streets when he was domestic policy advisor to Richard Nixon, 1960, late 60s. And they had the French Connection, and they broke it up, and I won't go into that, but there's a history. Then there was the crack cocaine crisis in the 80s, and now we have something that it's very much a different animal, and I'll tell you why. I believe that throughout the ages, there will always be people who, because of their circumstances or their zip code or their whatever is afflicting them, they're going to seek comfort, if you will, in substances. And it's sad, it's tragic, but it's a reality. And they will always need our help. They'll always need our help to pull them out of hopelessness and to give them a different path to go on. But what I find with the current crisis we're in is that so much of the addiction we're dealing with started with legally prescribed drugs. Different. That's very different. No one was legally prescribing crack cocaine in 1986. They do prescribe opioids, which is basically heroin. And so what you had was people, an athlete in high school gets an injury, goes to the doctor. Here's a 30-day supply of hydrocodone or opioid-based drugs, and the kid and his mother and father saying, sure, doctor, man in a lab coat that we trust, or a woman in a lab coat that we trust, gave this to us and take it for 30 days. And then here's a refill if you need more. And this happened to so many people inadvertently, including my own nephew, who was injured cutting his hand in a deli when he worked as a 16-year-old, led to addiction until his death a year and a half ago. The path, the story that I heard repeated so often, it brings you to tears. So many parents came up to me and hugged me at these forums and says, I never would have given my child this if I had known that it would have led to a life of addiction. And that is something that people all across the state, from the most rural areas to the most densely populated cities, are having to deal with. And so, in one sense, as painful as that is, once we realized what was going on, and my husband, until very recently, was the United States Attorney from the Western District of New York, and he was sounding the alarm 7 years ago about there were doctors literally creating businesses and industries, over-prescribing people and making a huge profit, and those people are in jail today. So society, communities, people started realizing what was going on, and the governor and the legislature were able to do a lot about this. And I believe that we're going to be able to tackle this from a different approach now. I think that we're able to stop what I call the accidental addicts, the people who were improperly overprescribed because there's more awareness by doctors and dentists. Dentists, my 2 kids in high school given a 60-day of opioids for the wisdom teeth getting pulled out. My kids would have been addicts if they didn't happen to have a mother who was aware of this and said, suck it up, take an aspirin, you're going to be okay. And I knew better, but I feel for the parents who don't know better. How does anybody else know this? So you're following, again, a dentist. So I think we're going to stop the accidentally created addicts, because we have put a cap on doctor shopping. No longer can you go from a physician to an emergency room and fake an injury and go to this person. And we stopped all that, because every time there's a prescription for this, it's in a registry, and doctors and providers and emergency rooms will know that someone else has already just had a prescription. We can do that. We also just cut the prescription dosage time from 30 days to 7. Now, there are absolutely exceptions in need, particularly in people that, in palliative care, people that really need it. We're not insensitive to that. But we also just said, we know that your brain chemistry changes after 14 days on these drugs. So why do you need a 30-day supply? Because the impacts on the rest of your life could outweigh any short-term relief from pain. And that's finally what we're getting to in the medical community. We also, last year, one of the recommendations was doctor training, medical training. What's going on in our medical schools today? What was going on 5, 10, 20, 30 years ago when a lot of our doctors who are out there now were being trained? I'll tell you what I saw. I saw too many cases where the pharmaceutical representatives, who had a very strong profit motive, came and sold our doctors a bill of goods. No, this is not addictive. It's fine. Don't worry about it. Sorry, folks, we're on to you. It is. It is addictive. And so the doctors, we wanted to have training, and I have to tell you, I know there's a lot of doctors in this room, we had a lot of resistance to even having the state say that we think you should have at least 3 hours of training. And I'm thinking, how about a week? Because not only are you needing to know the negative impacts of certain drugs, but what are the alternatives? what homeopathic, holistic, or, whatever therapies there are, whether it's physical therapy or mental therapy, whatever you can do to relieve, people have to be taken out of pain, I get that. But the number one principle for doctors is do no harm. And more harm was being done to people in the long term, and they just didn't know it at the time. And now we do. So I believe that by cutting from 30 days to 7, it's going to have a big impact. We also heard a lot about how people finally hitting the bottom of the barrel, and they're desperate for help, and they want to get assistance, were turned away because the insurance companies just didn't think it was serious enough. And that happened to my nephew way too many times. And so you get people wanting help. If they're not getting the approval that very moment, so many times they go back to the streets because that was the moment they're ready to get help. 2 days later, a week later, just isn't going to help them. They're already back out there. A story told over and over again. So we've got after the insurance companies and says, how is it that someone walks into an emergency room in the throes of a heart attack, probably not walked in, carried in the throes of a heart attack, and you'll give them coverage without pre-authorization at that moment and take care of them and restore their health. But someone who's in an overdose situation shows up needing desperate help and like, well, we got to call the insurance company and get pre-authorization. We'll catch up with you later. That's over too. We just stopped that with legislation that we passed last July. So there's a lot more. We've made progress in this area, but the governor also says, we're not done. And I said this, we're not done. I'm going to reconvene the task force once again and say we have to do so much more because, this addiction, and the numbers you see, they say there's 1.4 million people in the state of New York addicted to heroin. I think it's higher. I think when I look at statistics and you look at the death certificates, so many times they had no idea that it was actually the overdose that killed people. I can tell when I look through the obituaries on a weekend in the Buffalo News. It's a 26-year-old, 27-year-old. No cause of death listed. I know what it is. I know what it is. Because unfortunately for too many of these families, there's a shame associated with this, a shame that should not exist. They should feel that there's more support. So we have done much more to fund peer navigators and some family support systems where my sister-in-law now works to help other families who went through the same pain she did. And my nephew's surviving sister works there as well. So there are a lot of families who've been through it, who want to give back, and we're supporting that at the state level as well. So we removed prior authorization, but what are we going to do this year? We're subjecting fentanyl. The criminal mind is so brilliant. They really are. This is my husband keeps telling me, you got to stay ahead of these guys. Now it's fentanyl. There's also something, and I forget what it's called, cateninol or something. It's like an elephant tranquilizer, the equivalent strength of an elephant tranquilizer that people are now ingesting, injecting, using as part of their substance abuse disorder. So heroin was bad. Fentanyl's really bad. I mean, if you look at the size of a grain of salt, that'll kill you. I mean, that's all it takes. Tiny doses of fentanyl can kill you. And now they've gone even more to the elephant-sized brand. So we are subjecting fentanyl to criminal penalties because fentanyl does have a legitimate use. I understand that. I had this all explained to me from doctors. They said you can't ban fentanyl. It's used instead of morphine when people are in surgery. Okay, I get that. But somehow we have to have more restrictions. It's coming in illegally from China, and I can get it online if I want to today. That's not right. We have to increase access to the treatment, the medically assisted treatment. And more people, EMS people, need to be trained, the first responders who show up on the ground. And I have to tell you, there have been in my county, Erie County, last year there were 1,400 Narcan saves, 1,400 saves. That would have been 1,400 more deaths on top of the 500 we already had. So that's working. Even the users and their families are now carrying it. Their friends are carrying it. But it's bizarre to me that there are circumstances where one person, and this is a true story, was brought back 3 different times in one day. I don't know what you do. And the responders are getting a little frustrated. They're still human beings. They deserve our assistance. But I was in one county, a very rural county, and they said, the sheriff says don't even use it because they're just going to do it again. I don't want to get to that point, but it's taking its toll. We are continuing, the governor's budget would propose more 24/7 crisis treatment centers, a pilot for recovery high schools, because so many kids, we don't want them to drop out where they're getting assistance. So we're trying to address this holistically because we have to. I don't know a family or a community that's not been touched by this in some way. So I know there's a lot of expertise in this room. I need you and your collective brain power to come together and help me and the governor formulate the next step, because New York is always proud that we lead. We want to be the model. We believe that we have a model, but I'm still reading too many names in the obituaries. So I think we'll stop the new addicts. I really do. This one category over here where they came from a legally prescribed drug, we still are going to have over here the people that are going to head down that path, and we still have to do much more in not just prevention, but the treatment and recovery. And that is where the political debate comes. There are other people, not my side of the aisle, but who don't believe that that's where we should be focusing our attention. I'm sorry, we have no choice. And we've been doing a lot here in the Syracuse area. In fact, I've been at a number of events. I was at Conifer Park in Liverpool. We opened up a 200-slot treatment center. I attended that last April. In Oswego, we have 100 slots opening at Farnham Family Services. Syracuse Brick House will be opening a 250-slot OTB in April 17. Just heard on the news today that there'll be another one opening. I'll be there probably April 10th. I spoke at the Prevention Network Family Support Navigators right here in July. I've been here a lot. And I have to tell you, what troubles me about this Onondaga area in Syracuse and central New York is that you have the third highest rate of babies being born now addicted to these substances. I mean, these babies, we already have one of the highest poverty rates in the nation here in Syracuse. Well, this is part of your larger conversation about what's going on in the neighborhoods, Doctor. But half of our kids in places like Buffalo, Rochester, and Syracuse, half of our kids live in poverty. Overall, the poverty rate here is about 35%. And it's starting to take its toll. And so you have babies now born who have a strike against them. They're born into poverty. If they're very likely to be born in poverty if they're in the city of Syracuse particularly. They're not getting the education they deserve. They probably have lead paint on the walls still. There's a lot of strikes against these kids. And I hope that as a society, we look at not just the impacts of heroin addiction, but the larger picture of what this means for the next generation that we're trying to move forward and give better opportunities to. But if their parents are stuck and they're stuck, the cycle is going to continue. And this is where I need expertise to help us break that cycle, because we've not been successful. And the governor started something called the Empire Anti-Poverty Initiative. We started it down the road in Rochester because, believe it or not, they're just a little worse than Syracuse. But we wanted to use that as a model and to have the community engaged in identifying literally the worst zip code in the city, bringing in all the partners, including the business community, saying, what are you doing to take people out of this community and give the teenagers and the adults a job or a mentorship or a shot at a community college education? So we really did that down in Rochester, and that has been brought over here to Syracuse, and we're working on that now. So we're optimistic about that we can help eradicate poverty. But we know that half of all the deaths in the state of New York occur because of modifiable behaviors, they're called. Tobacco use, your diet, alcohol. I mean, 47% of people die from things that and this has got to be very frustrating to you who are practitioners. Like, why do people do this? Why is this going on? I don't have an answer. But I saw a statistic just literally days ago, nationwide, the suicide rate and the alcoholism rate is up. It's going up. Now, I'm a little partisan. I don't know if that's just since the November election. I shouldn't say that. Forgive me for that one. Or don't, I don't really care. But people are feeling very disaffected, and they're feeling disillusioned, and they're feeling hopeless. And that troubles me. It troubles me greatly. And I feel that we need to do something about that, and I don't have the answers other than we're trying to hit it from a lot of different approaches. But I'll tell you, there's one battle that I need your help in. And what's going on in Washington? The governor and I have spent the last 2.5 weeks nonstop, and I know people in this room have helped too, to fight back the plan which would have decimated the state of New York with respect to our Medicaid coverage. It would have hurt our hospitals to the tune of $400 million, our nursing homes, $355 million, our home health care providers, over $300 million. New York State would have taken a $7 billion hit if the Affordable Care Act repeal and the extra amendment had gone on, that I won't talk about, the Collins Amendment, which would have imposed a penalty on New York State to the tune of $2.3 billion. They would have pulled $2.3 billion from the state of New York's Medicaid program just to convince us to take it off the counties. We would have been the only state in the nation to lose that kind of money. So it was a very punitive thing, and look up the articles, you get the whole history on it. But we were going to lose that. We have 2.7 million people in the state of New York who benefit from Medicaid. That is how they get the preventative services that we're talking about. That's how they get the breast cancer screening that the governor made a huge initiative last year, went all across the state talking about early screening. That is how they get their early diabetes testing. That's how they get better health outcomes that do not require them to walk in an emergency room and consider that their primary physician, which has been driving up our healthcare costs exponentially. We've gotten our arms around this. The Affordable Care Act has expanded healthcare coverage to millions of people in our own state, and I am shocked when I go to sometimes the most rural outlier areas, my old congressional district, and people did not know they're on Obamacare. They do not know they're on the Affordable Care Act. They think it just came a gift from heaven somehow. And they didn't, there's a huge disconnect from saying they support a person and policies, but they have no idea that it is taking away their ability to have the dignity of a good, healthy life. So we're sounding the alarm. People here have been at our side. The hospitals are stepping up. We beat it back last Friday, but I wake up Monday morning and the president's saying, oh, healthcare is easy, we're still gonna get it done. It's like, oh. So I'm hopeful that cooler minds will prevail, that people will still continue to see the benefits of expanding healthcare coverage. How can this be a bad thing? How can this be a bad thing that people have these services, particularly when we're talking about substance abuse treatment, which is covered? Because if people don't have this and they're addicted, I don't know that the morgues are big enough to handle this. It's kind of harsh, but that's the reality. So I need everyone, this person, to feel a personal responsibility to reach out to your elected officials at the federal level and say, what are you thinking? Give it more time to work. We're getting there. And let's fix what's wrong with it. No, it's not a perfect bill. But are you prepared to throw 27 million people, 7 million of which are in New York State, off the rolls to be able to get basic services for health care? I think the answer should be no, as all Americans. We're better than that. We're better than that. At least I'd like to think we are. Now, we don't have the coverage that they do in European and other industrialized societies. That's another whole debate. But at least we are making some steps. And I don't want to see the clock turn back. It was too big of a fight. It's the reason I lost my congressional seat is I refused to vote to repeal the health care bill. Just wouldn't do it. My district probably wanted me to. It was a very conservative district. But I knew deep down I couldn't do that to people. But I really like being lieutenant governor, so don't worry about me. I'm actually in a better place. So that's all I wanted to share with you today. Just some insights, perspectives to know that, we're all in this together. You have a state and a governor that really lives and breathes this. He cares deeply about particularly the upstate economy that he feels has been left behind. And Doctor, you know this, and working with Rob Simpson as co-chairs of the Regional Economic Development Councils and the assistance we've been bringing to this area because of the neglect, literally the benign neglect that occurred with respect to upstate New York for 40, 50 years. The governor recognized that. All the attention went to New York City. And now, like, hey, there's an upstate that needs our help. And so we have to take some time to fix it. We're getting there. We're making great progress. But I hope you feel a better sense of optimism than you did years ago. But the challenge remains is the health of our community is number one. It doesn't matter if there's great jobs available if people are suffering from addiction or they have diabetes or other illnesses that we could have worked on together. And so that's on your shoulders as well. That's on all of our shoulders. And I want to thank you for being great partners. I look forward to getting the results of the dialogue here. If we could share that with me, if there's any insights, something that we've missed at the state level that we can do to continue helping better the lives of people in our state, because that's what we're all here to do. Thank you very much.